Hello all, today we are going to discuss about diabetic ketoacidosis. Diabetic ketoacidosis is a dangerous complication of diabetes mellitus in which the chemical balance of the body becomes fat to acidic. So, in diabetic ketoacidosis is a life-threatening complication of diabetes that occurs when the body begins to break down fats for energy instead of sugars. In people without diabetes, insulin helps sugar enters the cells which use it for fuel. A person with diabetes does not make enough insulin to properly transport the sugar, which means their body cannot use it for energy. Without enough sugar, the liver turns some of the fat in the body into acids called ketones. Ketones build up in the bloodstream and spills over into the urine. When the excess ketone get into the blood becomes acidic, causing DKA. Diabetic ketoacidosis is a medical emergency. Anyone living with diabetes needs to learn the signs and symptoms of diabetic ketoacidosis to know when to seek urgent medical treatment. Then causes. Very high blood sugar level and low level of insulin cause diabetic ketoacidosis. Either illness or a problem with insulin therapy can put a person at risk of having high blood sugar or low insulin even with regular diabetic treatment. Illness and infections alter the production of some of body's hormones such as cortisol and epinephrine. Those hormones change how insulin works in body and can reduce its effectiveness, which some people may need to counter by taking extra insulin while they are unwell. Problems with prescribed insulin therapy can also cause DKA. Some issues with insulin therapy that may trigger diabetic ketoacidosis include a missing shot of an insulin, a clogged insulin pump, that is, the flow of insulin is blocked, preventing it from reaching the body, not using the correct insulin dosage. Other triggers for diabetic ketoacidosis can include a heart attack, a stroke, physical trauma such as car accident, emotional stress, drug or alcohol misuse, certain medications. People with type 1 diabetes or those who frequently miss insulin doses have a high risk of developing diabetic ketoacidosis. Some diabetic medications may increase the risk of DKA even when blood sugar is not high. DKA in type 1 versus DKA in type 2 diabetes. DKA is much more likely to occur in people with type 1 diabetes, but anyone with type 1 or type 2 diabetes can develop it. Those who need to take insulin have more severe form of diabetes and therefore will have a high risk of diabetic ketoacidosis. People with type 2 diabetes who may be prone to ketosis include older people, people who are overweight, people from non-white ethnic group. And next we can see about the symptoms. Symptoms of diabetic ketoacidosis can appear quickly and may include frequent urination, extreme thirst, high blood sugar levels, high level of ketones in the urine, nausea or vomiting, abdominal pain, confusion, fruity smelling breath, a flushed face, fatigue, rapid breathing, dry mouth and skin. Diabetic ketoacidosis is a medical emergency. If untreated, can lead to coma or death. If we use insulin, make sure the risk of DKA with the healthcare team and have a plan in place. If have type 1 diabetes, should have supply of home urine ketone test. Then diagnosis. Testing for ketone is a sample of urine is one of the first steps for diagnosing diabetic ketoacidosis. They will likely also test your blood sugar level. Other tests may or basic blood work including potassium and sodium to assess metabolic function, arterial blood gas, where blood is drawn from an artery determine its acidity, blood pressure, chest x-ray, or other tests to look for sign of an infection such as pneumonia. Then treatment. When treating diabetic ketoacidosis, doctors aims to normalize blood sugar level. They prescribe the following treatments: IV replacements, IV insulin drip unit blood sugar level drop to within an acceptable range, IV electrolyte replacements. The treatment for DKA can sometimes cause complications. Possible complications include hypoglycemia or low blood sugar from insulin rapidly entering the body, hypokalemia, or low potassium levels from fast fluid replacement, cerebral edema or swelling in the brain as a result of changing the blood sugar levels too quickly. Due to risk of these complications, doctors will closely monitor people with DKA in hospitals. Then prevention. Share on Printers regularly checking blood sugar can help prevent diabetic ketoacidosis. A person with diabetes can take many steps to prevent diabetic ketoacidosis. Preventing diabetic ketoacidosis usually centers on learning how to manage diabetes well. Preventative steps include repetitive testing the blood sugar to make sure that it is not getting too high, taking oral and injected diabetic medications according to the prescription, asking a doctors about adjusting insulin dosage if necessary, particularly if blood sugar is high, checking ketone level in the urine when ill or after an injury. Anyone who suspects that may have DKA should prepare to act quickly and seek emergency medical treatment. Thank you.